Magandang gabi, Luzon, Visayas, Mindanao. Ang pamilyang De La Cruz mula sa bayan ng Kalibo, Aklan ay nagsend ng video sa aming team. Di umano ang kanilang anak ay sinasapian na itago na lang natin sa pangalang Neneng.
Hindi ko rin po alam kung bakit po siya nagkaganyan. Isang beses po, sabay-sabay lang naman kami kumain, tapos bigla na lang siyang napahiga. Akala niyo po ba sinasapian?
Bago rin po ang pangyayaring ito, nilagnat at madalas na rin po siyang matamlay. Nagrereklamo na rin po siya na sumasakit ang ulo niya.
Kahapon tsaka nung nakaraang araw din po nahihirapan ako. Kasi minsan kung ano-ano lang po nakikita ko, hindi ko po alam kung multo o tao. O kaya po yung mga bagay sa paligid ko basta-basta na lang gumagalaw.
Parang may nakikita po ba kayong mga anino o minsan naririnig na rin? Nag-hallucinate, ganon?
Parang gano'n na nga po.
Hinala naman ng nanay ni Neneng na ang kanyang anak ay tila ba kinukulam.
Sana po matulungan niyo po ang aking anak. Ang hinala po namin, baka po nakukulam na siya. Sapagkat matalinong bata tong si Neneng. Lagi na nanalo sa pa-contest sa school nila. Lagi nga rin niyang nakikwento sa amin na pangarap po niya maging isang nurse paglaki.
Para matulungan si Neneng, agad na lumipad ng aming team patungo sa Kalibo, Aklan. Kami rin ay nagsama ng isang neurologist na si Dr. Zain at Dr. Kia na siyang nag-specialize rin sa iba't ibang infection diseases.
Magandang umaga po sa inyo. Ako po si Miss Chavez galing sa NURS Network. Kamusta naman po ang kalagayan ni Neneng? Nako, nilalagyan na naman ho siya. At alam niyo po ba nasakit daw yung mga kalamnan. Sa tingin niyo po ba nakulang na po talaga sa dyan si Neneng?
Tumabi ho muna kayo! Dadalhin natin siya sa pinakamalapit na ospital! Pagkatapos po namin mag-conduct ng test and examination, alam na po namin ang nangyari kay Neneng. Hindi po siya nasasapian o kinukulam. Siya po ay nakararanas ng sakit na encephalitis.
Ano po ba ang encephalitis?
Encephalitis came from the Greek words encephalos na ibig sabihin ay brain at itis naman na ibig sabihin ay inflammation. It is an acute brain inflammation or swelling caused by a viral infection or the body's immune system erroneously attacking brain tissue. Encephalitis usually starts with a high temperature and a headache. The symptoms rapidly worsen and there may be seizures, confusion, drowsiness, loss of consciousness, and even coma. Ang Japanese encephalitis virus or JEV is the leading cause of viral encephalitis in Asia at ito rin sa case ni Neneng. It is a flavivirus transmitted by mosquitoes and belongs to the same genus as dengue, yellow fever, and West Nile viruses.
Is this disease deadly, Doc? Can any of the patients suffering from encephalitis survive?
According sa ating DOH, 3 out of every 10 JE individuals that develop severe disease die. More than half of those who survive will have severe residual, neurologic, psychosocial, intellectual, and or physical problems, such as paralysis, recurring seizures, or inability to speak.
Ibig sabihin, Dok, hindi po pala nasasapian si Neneng?
Yes, si Neneng ay nakaka-experience ng seizures. Isa sa mga symptoms ng encephalitis. Ang iba pang symptoms ay fever, photophobia, or eye discomfort in bright light, lethargy or lack of energy, myalgias or muscle aches, clumsiness, and cough. Ang iba namang tao na malala na ang lagay ay nakararanas ng extremely painful headaches, nausea and vomiting, partial paralysis in the arms and legs, speech and hearing problems, hallucinations, memory loss, seizures, and coma. At para naman sa mga baby or infants, ang sintomas nito ay vomiting, a bump located close to the soft area on the top center of the skull, which is the frontanel. Continuous crying does not stop even after the infant is giving attention and comfort. And lastly, body stiffness.
Bakit naman po nagkakaganto yung anak ko?
So, Japanese viral encephalitis or JEV is caused by the mosquito species Culex or specifically mainly by Culex tritennior rhynchus. Ang nangyayari po bale, nalilipat po sa katawan ng tao yung virus pamamagitan ng kagat ng mga lamok. Mukhang kailangan nyo nang gumamit ng katol, misis.
Paano niyo po nalaman na may ganong sakit yung anak ko?
Kanina, Neneng, while you were still unconscious, you conducted several tests with the consent of your parent, of course, such as physical examination. At yung iba naman, habang conscious ka pa, di ba, nag-take kami ng blood test, stool, and urine test. Dagdag pa rito yung CSF diagnostics or lumbar puncture, kung saan nandun yung spinal tap, or CSF PCR. Dagdag pa rito ay ang computed tomography or CT scan at magnetic resonance imaging or MRI. At huli ay ang electroencephalography or EEG. At sa pamamagitan ng mga yon, na-diagnose namin na meron kang Japanese encephalitis.
Magagamot pa po ba ako, Doc? Do I have a chance to live or survive this? Natatakot po ako.
Sorry I'm late. I'm Dr. Kea and isa pa ako sa mga doktor na naka-assign din kay Neneng. So, in her case, supportive treatment will be applied. So, yung first measures is the correction of her electrolyte imbalance, then yung autonomic dysregulation, and any problems with her renal and hepatic dysfunctions. Then after that, we will now start administering drugs that she may need, such as antiviral drugs and medications administered to IV to reduce her brain swelling. Apart from that, we will also give her pain relievers as needed, and if she feels nauseous, antiemetics is also available. Then for her seizures, we will give her anticonvulsants and medications to reduce her fever, and finally, fluids to prevent her from dehydrating.
After ng treatment, Doc, ano na pong gagawin namin?
Well, sa Japanese encephalitis, the treatment is primarily symptomatic. Then we will then proceed to manage it to prevent severe morbidity and mortality. So sa case ni Neneng, she needs a lot of bed rest, plenty of fluids, anti-inflammatory drugs, yung mga na-prescribe sa kanyang gamot, then antiviral drugs, and finally, kapag nag-show si Neneng ng difficulty in speaking, or yung mga physical functions na kaya niyang gawin dati at hindi na ngayon, then we will need to do follow-up therapy, such as physical therapy, speech therapy, or psychotherapy, and others.
Dok, ano naman po ang masasuggest niyo po para hindi na po ito maulit sa kahit sino man po sa amin?
Well, the best way to prevent encephalitis is to practice good hygiene. Ugaliing maghugas ng kamay, lalo na bago at pagkatapos kumain. Another is to avoid sharing utensils to avoid the transmission of virus. It is also essential to get vaccinated and get your vaccinations updated. And finally, use insect repellent to avoid insect bites that, like mosquitoes, that might cause encephalitis.
Matapos nating malaman na ang nangyari pala kay Neneng ay hindi pananapi, kundi Japanese encephalitis virus, atin namang kausapin si Dr. Armira mula sa California, USA upang malaman natin ang mga posibleng complication ng sakit na ito.
Japanese encephalitis can cause serious complications or even death, and it can quickly progress to severe brain infection or yung tinatawag nga natin na severe encephalitis with complications such as permanent damage sa ating brain or nervous system. Furthermore, half of the total population of people na nakasurvive sa symptomatic Japanese encephalitis eventually develop complications, according to Health Direct Australia. Since it causes damage to our brain, maaari itong mag-iwan ng long-term effects such as cognitive impairment na maaaring makaapekto sa ating abilidad na makaalala, matuto ng mga bagong bagay, concentrating, and even decision-making sa ating pang-araw-araw na buhay. It can also impair our speech and language ability and can cause upper and lower neuron weakness, which will result to us having difficulty in our balance, coordination, and movement. Also possible din ang pagkakaroon ng swallowing problems, recurrent seizures or epilepsy, at palagi ang pagkapagod or persistent tiredness. Lastly, dahil sa mga complications na ito, maaaring maapektuhan ang ating personality and behavior.
Thank you very much, Dr. Almira. Viral encephalitis or Japanese encephalitis is a serious and terrifying disease. We hope that we were able to provide insights in order to enlighten our viewers about this disease, how it can be treated, and the possible ways we can prevent it. And always consult your doctors if you ever experience any of the symptoms. Thank you for watching the Sunday special about encephalitis. We will see you again next Sunday for another episode of Kapamilya Mo, Jessica Solo.